several chronic diseases. Family influences. So when you think of obesity, the eating disorder you're going to think of is called binge eating. So DSM-5 identifies binge eating disorder as an eating disorder that can lead to obesity. So just like bulimia, binge eaters consume a large amount of food. But the difference is, and you need to know the difference, the big difference is these individuals do not engage in behaviors to get rid of the excess calories. So if they're not getting rid of the excess calories and they're ingesting a large amount of food, they're going to gain weight. So this is the eating disorder that is associated with obesity. And the diagnostic criteria for binge eating disorder is a sense of lack of control, eating more rapidly than normal, and feeling guilty after overeating. I have a really close friend who has struggled with binge eating, and I know that she feels really guilty after she has an episode of binging. So for obesity, again, genetics plays a factor. If a child's parents are both obese, there's about an 80% chance that they're going to be obese as well. There's also some studies that show that twins are more likely to be obese. And then other factors, again, if your hypothalamus has lesions on it or if it's dysfunctioning somehow, it can mess with your appetite. Hypothyroidism, decreased insulin production, and increased cortisol production. And then, of course, you got the lifestyle factors of living a sedentary lifestyle and eating too many calories. So there's several nursing diagnoses for eating disorders. Of course, you're going to have imbalanced nutrition, less than the body requires. That can be related to, if it was anorexia, so refusal to eat. You can also have imbalanced nutrition more than the body requires, and that would be related to compulsive eating, and that would go with binge eating disorder. Deficient fluid volume, and that could be related to purging, laxative abuse, ineffective denial, and that is often related to a lack of control. Disturbed body image and low self-esteem, that can be related to dissatisfaction with the body or a dysfunctional family system. And then anxiety and feelings related to feeling helplessness or a lack of control. Okay, here's a question. A client is 5'8" and weighs 105 pounds. The client has been taking laxatives daily and self-induces vomiting after eating. Which is the priority nursing diagnosis for the client? Ineffective denial, disturbed body image, low self-esteem, or imbalanced nutrition less than the body requires. You're looking for the priority. Good. So all of them are probably true, but you're looking for the priority, and imbalanced nutrition can cause a whole lot of problems. Especially it says in the question that they were self-induced vomiting, so